Question 1. What is the primary purpose of applying the ALARA principle in medical imaging? A. To ensure all imaging procedures are completed as quickly as possible. B. To achieve the lowest possible radiation dose without compromising image quality. C. To limit the number of imaging exams a patient can have in a year. D. To maximize the radiation dose to effectively visualize dense tissues. Answer: B. To achieve the lowest possible radiation dose without compromising image quality. This question focuses on the core concept of radiation safety in medical imaging. The acronym ALARA, a critical keyword, stands for as low as reasonably achievable, guiding radiographers to minimize radiation exposure to both patients and staff. The primary goal is to produce diagnostic quality images using the absolute minimum amount of radiation possible, balancing patient safety with clinical necessity. For example, selecting appropriate exposure factors and using proper collimation are practical ways to adhere to ALARA. Always remember that ALARA is about finding that sweet spot where you get the best image with the least dose. Question 2. Before administering intravenous contrast media, which of the following patient assessments is most crucial for a radiographer to perform? A. Assessing the patient's dietary preferences. B. Confirming the patient's height and weight. C. Checking for allergies and renal function. D. Measuring the patient's blood pressure and heart rate. Answer: C. Checking for allergies and renal function. This question highlights essential patient safety considerations when administering contrast media. The keywords intravenous contrast media and most crucial direct you to potential risks like allergic reactions and kidney damage. Contrast media is excreted by the kidneys, so impaired renal, kidney, function can prevent proper clearance, leading to complications. Always ensure you confirm any known allergies, especially to iodine or previous contrast reactions, and verify the patient's renal function status, often via blood tests like creatinine, before administration. This vital step helps prevent life-threatening adverse reactions and kidney complications. Question 3. What is the primary function of the collimator in an X-ray unit? A. To generate X-rays. B. To filter low-energy X-rays from the beam. C. To restrict the size and shape of the X-ray beam. D. To cool the X-ray tube during operation. Answer: C. To restrict the size and shape of the X-ray beam. This question addresses a fundamental component of radiation protection and image quality in radiography. The collimator is a crucial device, specifically designed to control the area of the patient's body exposed to the X-ray beam. By restricting the beam size, it minimizes patient dose to only the region of interest and reduces scattered radiation, which improves image contrast. For instance, when imaging a hand, the collimator ensures only the hand is irradiated, not the entire arm. Remember that proper collimation is key to both patient safety and producing high-quality diagnostic images. Question 4. A patient arrives for an abdominal X-ray and states they are pregnant. What is the radiographer's immediate and most appropriate action? A. Proceed with the X-ray but use extra shielding. B. Inform the referring physician immediately and postpone the exam. C. Document the pregnancy and complete the exam with reduced exposure factors. D. Ask the patient to sign a waiver acknowledging the risk. Answer: B. Inform the referring physician immediately and postpone the exam. This question tests your understanding of critical patient safety protocols, especially concerning pregnant patients. The keyword pregnant immediately signals a need for extreme caution due to potential risks to the fetus from radiation exposure. It is always the most appropriate action to stop the procedure, inform the referring physician, and await further instructions, as alternative imaging methods might be considered or the exam rescheduled. Never proceed with an elective X-ray on a pregnant patient without specific medical justification and a physician's direct order. Patient safety, particularly for vulnerable populations, is paramount. Question 5. Which of the following image quality factors is primarily influenced by the kilovoltage peak, kVp, setting on an X-ray unit? A. Spatial resolution. B. Image density. C. Image contrast. D. Magnification. Answer: C. Image contrast. This question focuses on the fundamental relationship between X-ray exposure factors and image quality. Kilovoltage peak, kVp, is a critical keyword, as it primarily controls the penetrating power of the X-ray beam and, consequently, how different tissue densities are represented on the image. Higher kVp values produce a longer scale of contrast, lower contrast, meaning more shades of gray, while lower kVp values result in a shorter scale of contrast, higher contrast, showing more black and white. For example, a lower kVp might be used for extremity imaging to achieve higher contrast for bone detail. Always remember that kVp is your primary control for image contrast. Question 6. What is the correct medical term for a collapsed lung? A. Pleural effusion. B. Pneumothorax. C. Hemothorax. D. Bronchitis. Answer: B. Pneumothorax. This question assesses your knowledge of basic medical terminology relevant to common chest conditions. The keyword collapsed lung directly describes a pneumothorax, a condition where air leaks into the space between the lung and chest wall, pleural space, causing the lung to collapse. Pleural effusion is fluid in that space, hemothorax is blood, and bronchitis is inflammation of the bronchi. Understanding these terms is crucial for interpreting physician orders and recognizing patient symptoms during imaging. For instance, a patient with acute shortness of breath might be presenting with a pneumothorax, requiring urgent imaging. Question 7. According to the principles of radiation protection, which of the following is the most effective way to reduce occupational dose for a radiographer? A. Increasing exposure time. B. Decreasing shielding. C. Maximizing distance from the source. D. Holding the patient during exposure. Answer: C. Maximizing distance from the source. This question emphasizes the core principles of radiation protection for occupational workers. The keyword most effective points to the primary methods of minimizing dose, which are time, distance, and shielding, TDS. Of these, increasing your distance from the radiation source is the most impactful way to reduce your exposure, as dose rate decreases significantly with increased distance, inverse square law. For example, standing a few steps back from the X-ray tube during an exposure dramatically reduces your dose compared to standing close. Always prioritize maximizing your distance whenever possible to keep yourself safe. Question 8. Which imaging modality uses a strong magnetic field and radio waves to produce detailed images of organs and soft tissues? A. Computed tomography, CT. B. Magnetic resonance imaging, MRI. C. Ultrasound. D. Nuclear medicine. Answer: B. Magnetic resonance imaging, MRI. This question tests your knowledge of the fundamental principles behind different medical imaging modalities. The keywords strong magnetic field and radio waves are definitive indicators for magnetic resonance imaging, MRI. Unlike CT, which uses X-rays. MRI uses these magnetic and radiofrequency pulses to create detailed anatomical images, particularly excellent for soft tissue differentiation. For example, an MRI is often used to visualize the brain, spinal cord, and joints due to its superior soft tissue contrast. Remember, if it involves powerful magnets, it's MRI. Question 9. Before a barium enema examination, what pre-examination instruction is most critical for the radiographer to review with the patient? A. To avoid eating fatty foods the day before. B. To stay well hydrated after the procedure. C. To complete bowel preparation thoroughly. D. To refrain from taking blood thinners. Answer: C. To complete bowel preparation thoroughly. This question focuses on essential patient preparation for a specific contrast study. For a barium enema examination, thorough bowel preparation is the most crucial pre-exam instruction because the colon must be completely clear of fecal matter for accurate diagnostic imaging. Any residual stool can mimic pathology, obscure findings, or make the study non-diagnostic. For instance, if the bowel isn't clean, small polyps might be missed. Always emphasize the importance of following the bowel prep instructions exactly to ensure the best possible diagnostic outcome. Question 10. What term describes the unwanted random fluctuations in image density that appear as a grainy texture on an X-ray image? A. Quantum model. B. Spatial resolution. C. Contrast resolution. D. Image blur. Answer: A. Quantum model. This question probes your understanding of specific factors affecting image quality in radiography. The keywords unwanted random fluctuations, grainy texture, and image density all point directly to quantum model. Quantum model occurs when there are too few X-ray photons reaching the image receptor, creating a statistically insufficient number of photons to form a smooth image. This is most often seen with very low MOS settings. For example, an underexposed image might appear speckled due to pronounced quantum model. Remember that quantum model is essentially photon starvation on your image. Question 11. Which anatomical structure is commonly visualized on an AP, anteroposterior, projection of the pelvis for hip fractures? A. Cervical vertebrae. B. Rib cage. C. Femoral heads. D. Carpals. Answer: C. Femoral heads. This question tests your anatomical knowledge and understanding of common radiographic projections. For an AP projection of the pelvis specifically for hip fractures, the femoral heads are the most critical anatomical structures to visualize clearly, as they form part of the hip joint. The pelvis encompasses the acetabulum, and the femoral heads articulate within it, making them key for assessing hip integrity. For instance, a fracture of the femoral neck, just below the femoral head, is a common hip fracture visualized on this view. Always associate the projection with the specific anatomy it aims to evaluate. Question 12. What is the primary function of the anode in an X-ray tube? A. To emit electrons. B. To provide a vacuum. C. To absorb heat and produce X-rays. D. To focus the electron beam. Answer: C. To absorb heat and produce X-rays. This question delves into the fundamental components and function of an X-ray tube. The anode is a crucial component. Its primary function is to receive the high-speed electrons from the cathode and, through rapid deceleration, convert their kinetic energy into X-ray photons and a large amount of heat. It's often made of tungsten due to its high melting point and atomic number, which efficiently produce X-rays. For example, the rotating anode helps dissipate the immense heat generated during X-ray production. Remember that the anode is where X-rays are actually produced. Question 13. When performing a portable chest X-ray on a patient in isolation, what is the radiographer's first priority after receiving the order? A. Gather all necessary imaging accessories. B. Review the patient's medical history. C. Don appropriate personal protective equipment, PPE. D. Explain the procedure to the patient. Answer: C. Don appropriate personal protective equipment, PPE. This question emphasizes the critical importance of infection control and personal safety in the clinical environment. The keywords portable chest X-ray and patient in isolation immediately indicate a need for strict adherence to isolation precautions. Before even entering the room, your first priority is to don appropriate personal protective equipment, PPE, to protect yourself and prevent the spread of infection. For instance, if the patient is in droplet isolation, you'll need a gown, gloves, and a mask before entering. Always remember that your safety and preventing cross-contamination are paramount when dealing with isolated patients. Question 14. What effect does increasing the source-to-image receptor distance, SED, have on radiographic image intensity, assuming other factors remain constant? A. Increases image intensity. B. Decreases image intensity. C. Has no effect on image intensity. D. Primarily affects image contrast. Answer: B. Decreases image intensity. This question explores the relationship between geometric factors and X-ray beam intensity, a key aspect of radiographic physics. When you increase the source-to-image receptor distance, SED, the X-ray photons spread out over a larger area, causing the intensity of the beam reaching the image receptor to decrease. This is due to the inverse square law, which states that intensity is inversely proportional to the square of the distance. For example, if you double the SID, the intensity reaching the image receptor is reduced to 1/4. Always remember that increasing SID means less radiation reaches the image receptor, requiring adjustment of MOS to maintain density. Question 15. A patient undergoing a CT scan reports feeling extremely claustrophobic. What is the most appropriate initial action for the radiographer? A. Tell the patient to try and relax and proceed with the scan. B. Offer to reschedule the scan for another day. C. Stop the procedure and offer reassurance, explaining what to expect. D. Administer a sedative without physician approval. Answer: C. Stop the procedure and offer reassurance, explaining what to expect. This question addresses a common patient care scenario, specifically dealing with patient anxiety during imaging. When a patient reports feeling claustrophobic, your most appropriate initial action is to stop the procedure and address their concerns. Offering reassurance, explaining the process, the duration, and how they can communicate can often help alleviate their anxiety. For example, explaining that the scan will be quick and they can talk through the intercom empowers the patient. Always prioritize patient comfort and communication to build trust and potentially continue the exam successfully. Question 16. What is the recommended position for a patient experiencing syncope, fainting, in the imaging department? A. Sitting upright in a chair. B. Lying supine with feet elevated. C. Standing upright against a wall. D. Lying prone with head turned to the side. Answer: B. Lying supine with feet elevated. This question tests your knowledge of immediate patient care in emergency situations. When a patient experiences syncope, fainting, it's often due to a temporary reduction of blood flow to the brain. The recommended position is lying supine with feet elevated, which helps to promote blood flow back to the brain. For instance, placing a pillow or block under their feet can facilitate this. This position also helps prevent injury from falling and can aid in quicker recovery. Always remember to prioritize patient safety and help restore cerebral blood flow promptly. Question 17. Which of the following best describes the function of a photostimulable phosphor, PSP, plate in computed radiography, CR? A. It directly converts X-ray photons into electrical signals. B. It stores the latent image until it is processed by a laser scanner. C. It emits light in direct proportion to the X-ray exposure. D. It digitally transmits images to a PACS system in real time. Answer, B. It stores the latent image until it is processed by a laser scanner. This question focuses on the specific technology used in computed radiography, CR. A photostimulable phosphor, PSP, plate is the core component in CR, acting as the image receptor. Its function is to absorb the X-ray energy and store the latent image in the form of excited electrons until it is read by a laser scanner. The laser then causes these electrons to release light, which is converted into a digital signal. For example, after an exposure, the CR cassette is inserted into a reader which scans the plate with a red laser. Remember that the PSP plate is the temporary memory card for the X-ray image in CR. Question 18. What is the appropriate angle for needle insertion when performing an intravenous, venipuncture for contrast injection? A. 5 to 10 degrees. B. 10 to 15 degrees. C. 25 to 45 degrees. D. 60 to 75 degrees. Answer, C. 25 to 45 degrees. This question assesses your practical skills and knowledge for a common procedure in medical imaging. When performing an intravenous, venipuncture, the appropriate angle for needle insertion is typically between 25 to 45 degrees. This angle allows for smooth entry into the skin and then into the vein, minimizing the risk of piercing through both walls of the vein or just skimming over it. For example, after the initial skin puncture, you might slightly decrease the angle as you enter the vein. Always aim for a controlled, shallow angle to ensure successful and safe venipuncture. Question 19. If an X-ray image appears overexposed, too dark, what adjustment to the MOS, milliampere seconds, setting would be appropriate to correct the next image? A. Increase the MOS. B. Decrease the MOS. C. Increase the kVp. D. Decrease the SID. Answer, B. Decrease the MOS. This question tests your understanding of how exposure factors affect image density. An image that is overexposed, too dark, indicates that too many X-ray photons reach the image receptor. Since MOS, milliampere seconds, directly controls the quantity of X-rays produced and, consequently, the overall radiographic density, you would need to decrease the MOS to make the next image lighter and achieve appropriate density. For example, if an image was shot at 20 MOS and is too dark, reducing it to 10 MOS would lighten the image. Always remember that MOS is your primary control for the overall blackness or brightness of your image. Question 20. What is the main purpose of filtering the X-ray beam? A. To remove high-energy photons. B. To reduce patient dose by removing low-energy photons. C. To increase the overall intensity of the beam. D. To narrow the X-ray beam size. Answer, B. To reduce patient dose by removing low-energy photons. This question is about a fundamental concept in radiation physics and safety. The main purpose of filtering the X-ray beam is to reduce patient dose by removing low-energy photons. These low-energy photons contribute significantly to patient skin dose but do not have enough penetrating power to reach the image receptor and contribute to image formation. For instance, a thin sheet of aluminum is often used as a filter to harden the beam, making it more energetic and less harmful to the patient. Always remember that filtration is a crucial method to protect the patient from unnecessary radiation. Question 21. Which type of fracture is characterized by the bone breaking into multiple fragments? A. Transverse fracture. B. Oblique fracture. C. Spiral fracture. D. Comminuted fracture. Answer, D. Comminuted fracture. This question assesses your knowledge of basic fracture terminology, which is essential for accurate communication and image interpretation. A comminuted fracture is specifically characterized by the bone breaking into multiple fragments. This is distinct from other types like transverse, straight across, oblique, at an angle, or spiral, twisting. For example, a severe impact injury might result in a comminuted fracture of the tibia. Understanding these terms helps you effectively describe and recognize different fracture patterns on radiographs. Question 22. When positioning a patient for a PA, post-anterior, chest X-ray, why is it important to depress the shoulders and roll them forward? A. To minimize patient motion during the exposure. B. To move the scapulae out of the lung fields. C. To ensure the patient is comfortable. D. To increase the overall image contrast. Answer, B. To move the scapulae out of the lung fields. This question focuses on a specific patient positioning technique for a common radiographic exam. For a PA chest X-ray, depressing the shoulders and rolling them forward is a crucial positioning maneuver designed to move the scapulae, shoulder blades, out of the lung fields. If the scapulae remain in the lung fields, they can superimpose over lung tissue, obscuring pathology or creating artifacts that mimic disease. For example, this slight repositioning ensures a clear view of the apices and lateral lung margins. Always remember this specific action helps ensure the best diagnostic quality for chest images. Question 23. What is the purpose of a lead apron used in medical imaging? A. To warm the patient during long procedures. B. To block scattered radiation from reaching the patient. C. To protect radiosensitive organs from primary beam radiation. D. To absorb all X-rays produced by the tube. Answer, C. To protect radiosensitive organs from primary beam radiation. This question tests your understanding of radiation protection equipment. The purpose of a lead apron is specifically to protect radiosensitive organs from primary beam radiation or significant scattered radiation. Lead is a dense material that effectively attenuates X-rays, reducing the dose to critical areas like reproductive organs or the thyroid, especially when they are outside the primary field of interest. For example, a lead apron worn by a pregnant patient during an X-ray of an extremity helps protect the fetus. Always remember that lead shielding is a barrier against harmful radiation. Question 24. A patient is scheduled for an MRI of the brain. Which of the following items is an absolute contraindication for this procedure? A. A removable dental retainer. B. A pacemaker's or implantable cardioverter defibrillator, ID. C. Surgical staples from a recent appendectomy. D. Jewelry that can be easily removed. Answer, B. A pacemaker or implantable cardioverter defibrillator, ID. This question addresses critical safety considerations for MRI procedures. The keywords MRI of the brain and absolute contraindication immediately highlight the strict magnetic field safety protocols. A pacemaker or implantable cardioverter defibrillator, ID, is an absolute contraindication because the strong magnetic fields can interfere with their function, potentially causing serious harm or even death. For example, the magnetic field could demagnetize the device or cause it to malfunction. Always meticulously screen patients for ferromagnetic implants and electronic devices before an MRI to prevent severe complications. Question 25. Which aspect of the X-ray circuit is responsible for increasing the voltage to the kilovoltage levels necessary for X-ray production? A. Rectifier. B. Timer. C. Step-up transformer. D. Filament circuit. Answer, C. Step-up transformer. This question delves into the basic physics of X-ray production and the components of the X-ray circuit. The step-up transformer is the specific component responsible for taking the incoming line voltage and increasing the voltage to the kilovoltage levels required to accelerate electrons across the X-ray tube. This high voltage is crucial for creating penetrating X-ray photons. For example, it transforms 220V input into tens or hundreds of thousands of volts. Remember that the step-up transformer provides the immense electrical potential needed to generate X-rays.